let's look at the opposite side of that now, from the enlargement to the reduction.
A breast reduction is done in a lady that has large breasts, obviously. You know, what's the difference between someone with just large breasts or someone that has breasts so large that they need reducing? And that has to do with the symptoms or problems they have related to their large breasts. Are they having breast pain that limits their ability to do exercise? Do they have neck, shoulder pain? Do they develop rashes underneath the breast from the weight of the breast and the skin rubbing on the skin? You know, those sorts of things separate someone with large breasts and someone with large breasts that cause functional problems. Those that have functional problems are candidates for breast reduction. And basically what we do is we leave we remove the vast majority of the breast tissue from the lower part of the breast, leave the nipple attached to a pedicle, raise that up, and then redrape the skin beneath it. You know, typically we'll remove anywhere from 1 pound to 2 and even upwards of 3 pounds of breast tissue depending on the extent of enlargement that they have. It's a procedure that immediate relief is noted after the surgery. So it's in women, for women seeking breast enlargement, they can't imagine someone getting a reduction. But if you talk to a woman that's in need of a reduction, it's pretty clear cut as to why they want it and why it will improve their quality of life.
In the few moments that we have left, one other area that you mentioned that we might want to cover, and that is the breast uplift, the difference between that and these other procedures?
Yeah, it's kind of a halfway between the other two. A breast uplift is for, you know, someone that is either, you know, through the years developed some droopiness, or a woman that has lost a lot of weight, or a woman that's had several children and breastfed. You know, all these things cause droopiness. A breast uplift removes no breast tissue. All it does is elevate the nipple and removes excess skin and sort of tightens the skin envelope of the breast. It's very common to do a breast uplift with implants to kind of give that fullness or roundness that's not present without them. The disadvantage of a mastopexy is the incisional scars. You know, we have to make some incisions on the breast to do that. Generally, that's something that is, you know, they generally heal very well, and most women are very willing to accept that, to have a more uplifted, youthful appearing breast.
Mm-hmm. And size is not a factor in this?
No, we do that in women with relatively small breasts and also women with large breasts. It's basically for, you know, for someone with droopiness, and you can either have a lot of skin and very little breast tissue, or a fair amount of breast tissue that has caused the droopiness over the years, and both those women benefit from a mastopexy or an uplift procedure.
Right. And when you mentioned scarring, as I understand, there are now new not only techniques but products available to help minimize those scars and help to almost make them disappear? Yeah,
there's silicone sheeting and some new things that have come up that in women that have a history of widened or thickened scars. We would institute that early on afterwards, yeah.
Very good. Dr. Scott, we are out of time. I thank you so very much for sharing your knowledge with us here today.
Good to be here again.